Welcome. This is Dr. Scott Lamp with the Roselle Center for Healing. We're talking about alternative care for knee and hip injuries. If you're overweight and you're trying to lose weight, but you have a problem with your knee and hip, it's going to be very hard to be able to do that. So we got to make sure that lower extremity is working well. Athletes, it's extremely important for people who are in running sports. For overall health, for overall well-being, be able to go out and walk, this is a class for you. Here's some stats: 300,000 total hip replacements each year. Researchers found folks 45 years and older accounted for 95% of those procedures. Over the 10 years, things have doubled in 2010, and there's going to be more than 300,000. We're probably over the 400,000 mark right now currently. Most of these are generally related to osteoarthritis. As for the knee, 700,000 knee replacements and growing. 1 million arthroscopic procedures, $50,000 per knee surgery. And what's interesting, a growing number of the younger people undergoing knee replacement surgery is something of a mystery. And the recommendations for knee replacements were not correlated with pain, disability, or radiographic severity. And severity we're talking about in regards to maybe on a pain scale of 7 to 10, 10 being the worst. Stronger consideration should only be with patients with long-standing pain at night or pain with weight bearing. In our office, we look at several different things. We look at the biochemistry. What kind of inflammation? What kind of things are missing? Water is like the number one thing that's responsible for maintaining integrity in the joint. Are you dehydrated? Or are you missing certain things or certain elements that need to make up cartilage? What's your history? What's your scar tissues? What kind of problems? Do you have a genital problem? Is there something that you had previous injuries that happened before? These are the aches and pains that we just are the injuries we had through our lives. And people don't think emotions might play a part, but they do, because there's something called the adrenal gland that we'll talk about a little bit later, but the adrenal gland is our internal steroid source. It actually helps as an anti-inflammatory. It's our fireman that puts out the fire. If we're stressed out emotionally, we can actually have an effect on how well we heal. Before we continue, we want to go and look at people who've actually done it right. Areas of the world that people live to higher ratios over 100, and they're still working in society. I mean, they're still 80s and 90s. They're still going out in the fields, or they're helping out families and things. And they don't have all these comorbidities like diabetes and heart disease. Their life is like a candle that burns, and then when it comes to the end, it just goes out quickly. Doesn't suffer like we have when we see the suffering that happens in nursing homes. These areas are called blue zones. And you look at Okinawa, Japan, we look at Greece, we look at Italy, we look at Costa Rica, the Seventh Adventists out of California. What are they doing? What they're doing is the power of 9. They're doing these things. These are overlaps that happen in here. And the one thing that's actually not on the list that is very important is they eat a lot of fish, omega-3s. Omega-3 is an oil. It greases the joints. It is anti-inflammatory, helps fight pain, important. They also move naturally, doing Tai Chi and yoga and gardening and doing things like herding and things of that. They're out, they're moving, they're doing things. They have a purpose in life. They know how to take life not so seriously. Eat lots of plant-based foods. 9 to 10, 11 base servings. French fry is not a vegetable. Family first, a sense of belonging, being the right tribe. The wine, the wine. But I think it's important for the people to understand, look at what other people are doing, and they don't have the medical problems that we have in the United States. Now to take a look at the anatomy of the hip and knee. The joint and its parts, the hip and knee and several other joints, probably at the ankle and also at the spine. Cartilage plays a big part. This is your shock absorber, and it's like a sponge. You push down the sponge, you kind of get release some of the pressure. But like a sponge brings in water to it. When you take pressure off of it and you push pressure back on, it pushes the water out. That's how it feeds itself. But the cartilage has to be pushed and pressed throughout its whole area. The problem is when you have something like a ball and hip joint, something like a cup to where your femoral head or your hip goes into your pelvis. That cartilage needs to be pressed around that whole circumference of that ball and hip joint. And if it doesn't, then parts of that sponge do not move back and forth, and it does not feed itself. And it actually becomes brittle. Think about taking a sponge that's dry and rub it up on a hard surface. It crumbles, it breaks down. It needs fluids in there, but it needs to move. So the cartilage is a hard, slippery coating at the end of each bone. The cartilage breaks down and wears away in osteoarthritis. But if you had full movement in that joint and full movement to make sure all that cartilage works out, it works well. See, the thing is that we have a tendency to walk linear, forward and back. But how much do we work side to side? In Asian cultures, they do a lot of Tai Chi and yoga. They're moving the body in all different directions to make that work. Here we have a tendency, we're going to go out for a walk. We don't even stride well. We just have small little strides sometimes as we get older. We should work to try to get the legs to go out as far as they possibly can. And that movement actually helps us stretch the rest of the body if we don't do that. So in Asia, if you take vacation and if you're elderly, you like to go to those places where they have hotels with toilets. Because you go out in the countryside, they don't. They have a hole in the ground. There's no way that grandma and granny is going to be able to kind of squat down in a hole. They won't be able to get up. And that's why in the tourist trades, they have to have toilets over there. But we should be thinking about how to take care of the body, move that whole area, get that whole area moving. And you'll find out that you have less degenerative changes. Here's a joint capsule, a tough membrane sac that encloses the joints. There's synovium, a thin membrane inside the joint capsule that secretes synovial fluid, which is one of the slipperiest substances known to man. The synovial fluid lubricates the joints and keeps the cartilage smooth and healthy. Ligaments attach bone to bone. And this is an area of pain, sclerogenous pain, where you actually have an overstretched and irritated ligament, maybe done from some type of particular injury or scar tissue that's in it. So that's a considerations. Muscles can have, which moves your bones, can move from, have trigger points, have knots in the muscles themselves. But one of the key things about muscles is keep a balance. Make sure they're all doing the work, not one turning off and one's compensating, because when you do that over a period of time, it's going to create a problem. Labrum, fibrocartilage, it acts like a gasket, and you have labrums in your shoulder and your hip, which are very, very important about maintaining that ball and socket. Here's a picture of some of the anatomy of the knee that we talked about. And this is the ligament, the anterior ligament, the anterior cruciate ligament, the ACL. You see it in football injuries and those things like that, is when the knee's been pushed in such a way, pushed forward in such a way that tears that. It keeps it from translating the lower leg from the upper leg. And posterior cruciate ligament is the one that when the leg gets pushed back in the opposite direction. Collateral ligaments on either side, stability, keeps your knee from bowing too far in or out. Again, for stability, that's what the ligament's trying to do, to keep the bone to bone. Here we talk about some large muscles. Those are the quads. That actually helps you kick, go up the stairs. The IT band, which is a band that actually helps along the side of the leg. It actually attaches, and also the quad, from the hip area down to the knee. The popliteus muscle in the back helps you from hyperextending the knee, stabilizes the knee. And there's an interesting thing about some of these muscles, well, all these muscles. Every muscle has an organ relationship. And sometimes, here's a side note, if you have a problem with an organ, let's say a gallbladder, for example, the gallbladder relates to the back of the knee, you could actually inadvertently send signals to weaken the knee. So cleaning up the diet can actually affect the knee. Go figure. Here we have hamstrings on the backside, the shock absorbers of the body. These ones take a lot of abuse, especially when you have adductor muscles inside the legs go weak, and the hamstring needs to take the load, and they actually get really, really tight. They're doing their job because somebody else is not doing it. But the tearing and breaking down the hamstring or pulling a hamstring is usually based on another muscle not doing its work. And more examples. You can see how much ligaments that play a part in here. There's also the synovial membrane. You can see there's a part there that's part of that. But what's interesting here is this picture of the Glute Max over here on this side. And this one helps hold the integrity and balancing of the pelvis and other glute muscles, glute medius muscles, to try to maintain the pelvis while you're walking. So when you walk, the whole body doesn't fall down to the side that's stepping up. It actually maintains that. But if we have a weakness there, then we're going to start throwing off our body and how it walks and moves. When we're always looking at especially at the knee, alignments always look above and below the joint. You can do the same thing with the upper extremity. But since we're looking at the lower part, we're going to really look at what happens at the knee, but we also have to look at the foot as well as the hip to find out what's going on. So 80% of the injuries to the knee are related to the foot or hip problem. One of the things to assess is actually looking at something called the Q angle. And this is from the line of vertical and how much the leg goes inward. There's a lot of difference between the sexes because of the birthing canal for females. It's wider, causing the leg to go actually more inward on a certain Q angle. There's a certain degree that's acceptable. And if you keep on going beyond that, it creates problems on the inside part of the knee and collapsing on the outside part of the knee. Now, take a look over here. On the other picture, we have pronation. The foot, an arch drops down, which rotates the foot leg inward, which rotates the hip, causing distortion through the whole spine, which can cause problems in all these places, and even cause a problem in the low back. I've had actually in cases in some people where this has actually created headaches on people. You correct the arch, and the position of the head goes out of position, or you correct the arch, and all of a sudden the head position goes back to normal, and they're better. Again, the differences between the sexes. 1 out of every 10 girls aged 18 to 22 college year will suffer a major knee injury. There's 40% more knee injuries in women's professional basketball than men because of this Q angle. Positions of the hip are also important too, and it can be also caused by the foot or maybe positions of the knee itself. The hip can also have a problem that's there. It could be congenital. This is a normal position that we want to see, but if that's too far forward, and then there's a lot of kind of torque that's going on to maintain this position when it's gone too far forward. Same thing going backwards, and then there's a problem with the foot going inside. We can't ignore the foot when we're talking about knee and hip type of reactions. We want to maintain the arch of the inside part of the foot, where you go into things like pronation. We also want to take a look at elements of the transverse arch here, or the foot will actually drop down the middle and hit some nerves that are very painful. So something called Morton's neuroma. And the ability to be able to flex that first toe or extend the toe backward in walking is very, very important. If not, you put energies in other places. And of course, there's bunions. Shoes create a lot of problems for people, and we'll talk about it as we go along. Supination is another interesting one where you roll out to the ankle, the outside, sometimes because the outside stability is a problem here, and the cuboid bone, which is not seen in this picture necessarily, but it's on the outside, and sometimes that rolls in will actually make this muscle on the outside weak, and then the IT band also can be affected strongly with this. Here's different examples of some problems for hips and knees. Here's a toe-in effect, and toes in are kind of pigeon-toed, and then you can see the legs coming like that. Also, feet too far out can create a problem that's there. But what I wanted to do is focus on what's happening at the pelvis. This is a normal reaction. The foot raises up, and the pelvis and the muscle on the opposite side should be able to help hold the pelvis and the sacrum in the proper position. In this case, it doesn't. Causes a lot of strain in the back, pressures on places that are not supposed to be, and then we create some additional problems. So you got to take a look at the whole picture, not isolate certain parts of the body, because everything works as a unit. Some more examples. Here's where the knee actually kind of goes bow-legged. You can actually see the Q angle changes here a little bit. There's a normal one, and then we have knock-kneed. And again, you can see the pressure of the knees going inward. Here, that popliteus muscle that we talked about before helps keep the knee from going into hyperextension. If that's weak, it causes a bow-type sensation. So for proper gait, proper walking, we have to have great toe extension. That's got to be worked on. And again, bunions can become a problem here. Problems with sometimes people get a pin put into this. We have to have proper motion. There's something called toe off. We hit with our heels, we translate the rest of the body into mid stance, and we go off our big toe. To be able to do some of those things, we also have to have good flexibility at the ankle. Dorsiflexion means the foot has to come up. It's not 90 degrees, not just 90 degrees. You got to get another 20 degrees or so, or 30 degrees in there to be able to make that ankle work properly. Tight Achilles tendons, things create problems. Plantar fasciitis can be part of this kind of distortion. The hip has to extend backwards and good strides. You need to walk with good strides, not small little strides. Good strides would actually help you open up your body, opens up your ribs, get your body breathing better. At the time of COVID, we want to be breathing better, not walking small little baby steps. We want to be able to move in good stride. It actually helps open up our bodies. And the counter movement of the sacrum and the pelvis, making sure that that's moving correctly. Do I have strength in some of those muscles on the opposite side of the leg that's coming up to be able to maintain pelvis integrity? We have three modes of injury. One is compression, pushing down, physical compaction of the joint and surface, or blunt contusion of soft tissue and bone. The pressure, push, push, push. There's a certain capacity the body can load up. There's certain parts of the body. Usually what happens, it spreads. It's kind of like you spread the energy, you spread the ability to absorb that irritation. Shearing is actually going across the joint. Physical distraction or separation of joint surface and connective tissue. Sometimes these happen when you plant a leg and you turn and torque because of closed chain reaction. That happens with some of the football injuries. You take a look at it and say, was the foot planted when the person twisted or was it not? Makes a lot of difference because, again, a lot more shearing effect. Repetitive activation, recurring muscle contraction beyond physiological capacity. If you put irritation or put load on a muscle, does it have a chance to have a breather, or does it keep on working and working and it can't disperse that energy, and over a period of time it can't handle it, so it kind of gets into inflammation. A lot of things like tendinitis and things of that nature are these kind of things. So we're looking at history. We want to take a look at knee and hip injuries. We want to look at things like factors in balance, and that's going to be, do I have a problem with a balance? Maybe something in inner ear that might be a problem, and then my body's constantly compensating for those type of things. So there's 5 factors. We'll go over that in a bit. Genetics, the gender, male and female, what we just talked about before. Congenital defects also is a possibility that might be associated with it. Are you born with something that's a problem? Am I born with pigeon-toed, or do I have a problem in my hip itself? Predisposed, your past injuries, car accidents, sports injuries, and things like that. Secondary causes, predisposed. Another injury could also cause another problem in the body. Protectionism. Sometimes we overprotect things, and sometimes that happens, causes some atrophy of the body. Strength differences. Again, sedentary lifestyle can cause some problems, and looking above and below the joint, as we talked about before. Injury, again, was it traumatic? What type of injury was it happened? Was it shearing? Was it a compressional type problem? Do you have a lot of repetition that goes on? And then prolonged postures can play a problem too. To be able to sit for long periods of time, and you get your knee bent, and that knee and the patella is pushed into the knee joint itself, can cause some problems over a period of time. What kind of arthritis? And arthritis, there's over 100 kinds. The most common one is osteoarthritis, but then there's ones that actually attack the joint. There's inflammatory things. Do you have a bug of some sort? Do you have an autoimmune disease? Psoriatic arthritis. Some of these ankylosing spondylitis, and the disease process that's going on that complicates the matter. Here's a quick look of a normal joint again, and then we have a wearing down effect that happens down here. And osteoarthritis is really kind of a misnomer because itis usually means inflammation. It's usually a wearing down effect. If I'm a pitcher and my leg that goes down the hill of the pitching mound, it's going to put a lot more pressure on that part of the hip than the opposite hip, that's the following leg. If I'm somebody who is doing work on and carpet installing and smacking my knee up against the device to kind of install the carpet, that can cause maybe some problems. Or if I'm doing somebody in a squatting position for long periods of time, it could cause some problems. Now, this is the wearing down. Now, rheumatoid arthritis is different because now something gets inside here, and you can see this erosion that's happening here is actually something's inside causing an inflammatory process, an autoimmune disease, maybe a bacteria or a virus or some sort like that. We can get heavy metal deposits in here too. They could also create some problems. Lyme disease loves to go inside of joints, loves to go inside of cells, and so that's something that might be a possibility that might be happening. One of the common conditions is tendinitis. When the normal smooth and gliding motion of a tendon is impaired, the tendon will become inflamed and movement will become painful. Now, what's interesting is that that's true. The alignment, it has to work harder. So when we have bends and angles, especially when people like typing, for example, they have a bad body position and make most of the muscles in the wrist and the elbows work harder. Same thing with misalignment in the feet and the knees and so on and so forth. It can cause some of these problems. Also, the repetitive action, continuously moving and not having a rest cycle, can cause problems. The body can't disperse energy to the other muscles. It just starts using all other muscles. It tries to compensate, and that can create a problem. Example, baseball. I don't know if you're much understanding about baseball and how the pitch count goes, but parents are always concerned about their kids with the pitch count. The biggest concern is how much rest they have between a number of pitches. So if they pitch an inning and then they don't have a lot of time, their team is out 1, 2, 3 really very quickly, and they're back out there and throwing a lot of pitches. That breakdown, like 40 pitches, can be worse than somebody throwing about 60 or 70 pitches, because 60 and 70 can be spread out, and the 40 are all at one time. Then that can be very create a problem for that particular athlete. So here's sprains and strains. An injury to a ligament, tendon, or muscle where the force being applied to exceeds the capacity of that tissue to hold the joint stable and stationary or stable. Again, if I have my foot planted and I have what they call kinetic chain, or open kinetic chain, and my foot would be off the ground. And if I'm pushing there, and then all those forces, now I'm locked in, and I'm getting a force applied across the joint. And that's where you get a lot of the ligaments type injuries that happen. Overuse injuries, although known as cumulative trauma disorders, are described as tissue damage that results from repetitive demand over the course of time. And again, similar to tendinitis is also kind of formed into this, or the wearing of a particular area is how much rest period time do you have. Bursitis, a lot of times you think about that, especially at the hip, on the hip itself. Inflammation of the fluid-filled sac, or the bursa, which is kind of that synovial fluid, due to excessive compression or friction on that spot. Usually what happens, it starts with the muscle not being able to take the load, and the muscle starts showing weakness. The tendon can't take it, and now the bursa has to handle it, and they can't take it anymore. Now there is, you can have something called a hip pointer. We have direct pressure directly on that, which actually can cause injury directly to the bursa itself. That's usually a pinpoint irritation, but generally these are overuse syndromes. You can have some of the tears in the soft tissue. The one that works like a gasket is the labral here, and depending on the extent of how large this area of destruction is, will have an effect on your recovery and also possible surgery. Meniscus tears, again, you have the meniscus, which actually works as a shock absorber that's here. Sometimes that tears and degenerates. If it has a lot of compromise on the outside portions here, then what happens is harder for it to heal. But case-by-case basis, sometimes those might need some surgical intervention. A lot of times they do not. One of the best ways to take a look at gait is a dynamic foot assessment. We have a walking plate to go over. You move right and left foot, and you want to see how the foot hits at the heel, what happens at mid-stance, and how the toe off, and then measure those abilities and how the distribution of weight is over a period of time through this gait. This picture right here is a static picture, and there's another one that shows dynamic movement that's here. And again, I'm repeating the slide because the element of great toe extension is important. You got to be flexible at your ankle, your hip needs to extend, and counter movement at the sacrum and the pelvis. We talked about balance before, And balance really comes from how the body perceives the world, comes from the eyes. So to be able to see what's around you, the eyes play a major part to be able to see what's coming in. But also you have other senses that help you, like how does a blind person get around? Well, part of the ears are acoustic, and means like you kind of like with the stereo sound, you can point your head in the direction to where you see hear things. Vestibular is the fluid level in your ear to see give you an idea about what up and down is. So again, if you have an ear problem, could it affect your walking and balance? Of course it can. You have information that's in your spine that actually tells you where you are in position in space. And then also the muscles have little tissues that are called the Golgi tendon and muscle spindles. They give you proprioceptive, which means where you are in space to look around. So you get sensory input that comes in here, it integrates in the body, and you have motor output here. And part of this is the central nervous system, and this is also the peripheral nervous system. So you can have irritation and proprioceptive insults that are actually on your limbs themselves or coming from the spine. Now, this next slide, we're going to talk about Advanced Muscular Integrated Technique, the AMIT. It's a specialized technique in looking at muscles and breaking it down farther. The quad, you think about 4 parts of that muscle, it really actually breaks down to 14 parts. And the whole part of the AMIT is looking for the weak muscle. The weak muscle is usually 80% of the time the problem. The strong muscle seems tight or irritated, but it's trying to compensate for somebody else. So, for example, the body breaks down even farther, and looking at that and being able to test that, you can actually break the muscle into more additional parts. And again, we talked about muscle turnoff due to compensation. This may be in the years in the making. I hate it when somebody comes in and just says, you know, I just have weak ankles, doc. Well, I wanted to find out the reason why they have weak ankles. And there might have something been turned off and it never turned on again. And the things that turn this off are proprioceptive inputs from other parts of the body that can actually turn that muscle off. It could be an acupuncture point on the opposite side of the body. It could be an organ relationship that might be doing it. It could be something from the spine. It could be actually from the origin and insertions of the muscle. It could be a vascular point. It could be a lymphatic, which is where how the muscle drains fluids. It could be a problem in the lymphatic that might turn that muscle off. So this is where you have multiple circuit breakers involved. And so when you take a look at something, for example, like a hammer toe or a claw toe, do we have any problems with, the extensor muscle pulling this up or the flexor muscle down? If one of them is not doing its job, the other muscle is going to overcompensate and pull in that direction and distort that body position. Let's see how chemistry distorts the picture. Here's a lot of things that can cause possible inflammation. Remember, inflammation equals pain. One of the things that are most important that you can do is drink water. Dehydration is a major player in this. Half your weight in body ounces. The cartilage needs water to help make its water, kind of like its water balloon, to kind of help keep that cushioning that's in there. Milk and dairy products and gluten have been known to have an allergy-based type things. You take that in, 60 to 90% of your immune system is in your gut. If you're eating those type of things, you can accelerate inflammation in all parts of your body. Trans fats, similar. Caffeine has an effect on people, and vasoconstrictor. Smoking, again, getting into and causing damage throughout the whole body in multiple different ways. Alcohol can do it. Nsaids, you might want to take these to protect the body, but the problem over the period of time, it stops the whole inflammatory process. You need some inflammation to rebuild the body, but when it does that, it actually stops the whole thing. So you're covering up over the pain, but you're not necessarily taking care of the problem when you do that. And long-term use of this can actually help you destroy the joint. Red meats, one of the problems with that, especially the meats that are fed grains, have no omega-3s to them. They have a pro-inflammatory problem with them. Sugar and artificial sweeteners have problems. So other problems too, again, autoimmune diseases that you have. Rheumatoid arthritis plays a big part. You've got to handle that. Leaky gut. If you got a leaky gut, then you're going to also put inflammation through all other different parts of the body. EMF, electromagnetic fields, can play a problem because distortions affects the mitochondria of the body. Adrenal fatigue, since the adrenals are supposed to be your firemen and they're not working, that becomes a problem. Omega-3 ratios, anti-inflammatory, that's those fish oils we talked about in the blue zones. Overcooked foods. The body has to use up a lot of additional ingredients to break those things down. So overcooked foods can actually cause an inflammatory reaction, as well as lack of sleep. Heavy metal exposure has a tendency to be put into fat areas of the body. It can actually have an effect on joints, on brain capacity, so on and so forth. Depleted foods, things that are totally processed out. Those healing elements that are in foods, and you get them over-processed, what happens is you're not getting the foods that you need to kind of do with that. Crop spraying has its own problems, pollution, inflammatory. A lot of dental problems can happen with people too. The dental elements, things you put in your mouth, the prosthetics that are put in there, titanium, sometimes some people might have some problems with that. The root canal that's done, it leaks into the system. Those places problems. And then if your body's in an acidic state, acid, if you put acid in your skin, breaks things down. More alkaline states are better in a case-by-case basis, but most of the times you want to be out of an acidic state because that will actually increase inflammatory processes. Inflammation has a couple different pathways it goes through. There's pathways that actually, when the body is trying to heal itself, there's an omega-3 pathway, which is the one that we want to get into. That's here, and it's very anti-inflammatory in nature. And those are going to be kind of like your fish oils and flaxseed oils, good quality, free-range beef is a possibility. The omega-2 pathways, or that's omega-3 pathway. The omega-6 pathway is one that can be both pro and anti-inflammatory. And here's the pro-inflammatory ones that are here that causes pain, has to do with arachidonic acids. And then there's the anti-inflammatory pathway too. So there's a fork in the road here that causes some of this. And overcooked vegetable oils and things like that, processed foods can do this. And what's interesting is as the body processes and works with these pathways, you got to see what the body needs. It looks like it needs vitamin B6, magnesium, and zinc, and down here, vitamin C, niacin, and zinc. Very, very important substances to make the body process. And if we're depleted, we don't have that, we don't heal as well. How do we build with nutrition? With rebuilding bases, glucosamine and chondroitin help with the joint. Hyaluronic acid, very important. MSM, lip muscle. Manganese, especially for ligaments. Vitamin C, tissue repair. Vitamin E. All these are very, very important in rebuilding the joints. Do you have it in your diet? Some of the things anti-inflammatory that you can look at is ginger. Turmeric is one of the strongest ones. Resveratrol is another one that comes from, that doesn't always come from red wine. There's other types of mosses that have that. Omega-3s, things that are like in fishes and things like that. Boswellia, Arnica montana, which is a homeopathic, works really, really well, especially after surgery. These are things to take a look at. What I have on my shelf that won't do additional damage that actually I can use as a portive piece of my plan. Now, the allopathic approach is to treat the symptom, not the problem. And what we're talking about trying to deal with this, it seems to be after more of the problem. If you're just treating and just giving anti-inflammatories, what happens is that there is some side effects taking foods long term. Gastrointestinal bleeding, liver damage, bone loss. What happens is, again, if I take anti-inflammatories over a period of time, I'm going to start losing the ability to actually heal and start causing bone losses. Muscle relaxants, dependency, impaired cognitive. Sometimes when you take certain things, Flexeril, for example, you can't be driving a vehicle. You might be falling asleep. So there's other things nutritionally wise, even like maybe magnesium, that can help you a little bit without having the side effects of falling off and then being dependent on it. If you brace something over a long period of time, you're going to weaken the muscles involved. You don't use the muscles, then the atrophy. Bed rest, muscle atrophy, neurological regression. And let's take a look at some other things that we talked about, the structural things and trying to fix the angles and muscle balancing and things, but take a look at some other things or secondary causes here. Built-in survival reflexes. It's called a ligament interlink, which means that when you're running and moving, your ankle actually works with the opposite side wrist. The knee works with the opposite side elbow. The hip works with the opposite side shoulder. Your coccyx bone, or the tailbone, works with the xiphoid in the front. The pubic bone works with the mentum, or the front part of your jaw. And so they play a very interesting link if the ligament is injured, there is a relationship to the opposite limb that needs to be sometimes addressed. The TMJ plays a big part, and we'll get that in a minute. Organ muscle relationships. There is emotional relationships with these organs. So if we look at acupuncture, and we look at acupuncture, there is an acupuncture meridian or associated with every muscle in the body or organ system in every system of the body. But also, for every meridian system, there is an emotional relationship to, and we'll get to that in a minute. Acupuncture meridians, we'll talk about that in a second. Inflammatory control, we talked about the adrenal response and how the inflammatory element, it is your fireman. And if it's not working, and if it's low, it's not going to help support dealing with pain. And like we were talking before, this is the ligament interlink. Due to innate gait patterns, these are primitive gait reflexes that link opposite limbs to each other. One of the best things we talk about as a therapy is doing some cross-crawling. We've already kind of reviewed these. Sometimes you have to go up to the jaw. TMJ is temporomandibular joint, and TMD is temporomandibular disease. So if you have distortion in your jaw, the body always wants to keep the eyes level to the horizon. It's a survival type thing. So if the jaw is, or the body is distorted, the head's distorted, the craniofacial is distorted, and your eyes are not level, it'll try to shift the body and shift the head so it makes it level. But when you do that, you cause other compensations. The reason why it compensates is survival. I want to be able to run. Try to run with your head bent to the side. It doesn't work well. So the body will do that. And despite everything else, it will compensate other parts of the body to that. You could actually have to have a scoliosis pattern, which is a lateral movement or bending to the side movement of the spine based on this. So there's migration shifting that happens, sometimes with an overbite, sometimes with an underbite, can throw things out of place. If I have a short leg on one side, then the other shoulder will actually elevate and it's going to cause the hip to shift. So a lot of times we find that we have muscles that are inside the jaw that are off related to the muscles in the pelvis. Okay, the hip bone connected to the jawbone, so to speak. And one of the reasons why we sometimes have bruxism and tooth wear. And we'll give you a little picture of why this is important. So we take a look at some of these things. You can see if the jaw throws off, how it affects the pelvis itself. Affect the pelvis, affect the knee, so on and so forth. So it's kind of an integrated system when we're looking at the whole body. This is whole body dynamics. Remember before I said all muscles have an organ relationship. All muscles have a spinal relationship. There's an interesting thing if you take a look at the body and you look down around here in the lumbar spine, and these are the ones that actually can affect your knees and your legs and your low back is L3 on the spine, and L4 and maybe L2, the ones above and below it. So there's some spinal relationships that need to be addressed, especially when looking at knees. Sometimes just adjusting that takes care of the problem. And instead of just doing all these things to the knee, you adjust the nervous system, which is the coordinator of the whole system. It makes sense to look at that, and all of a sudden it seems to be better. But also, there's an organ relationship. And all organ relationships down here, you can take a look at the symptoms that happen. Okay, I can have in the bottom here a pain or numbness in the legs at the bottom. I can have low back pain, but I can also have constipation, colitis, irritable bowel. So some of those muscles, like for example the thigh muscles, the quad muscle, is a small intestine muscle. So if I have a problem with allergies, I could also have some problems in my small intestine. Or allergies, small intestine, I could also have problems in the quads. If I have problems with my large intestine, I might have some problems with my hamstrings. If I have problems with my adrenals, I might have problems with my calf muscles. If I have problems with the gallbladder, I could have some possibility of problems with the back of my knee. So everything's integrated in the body, and we have to take a look at a whole body approach. Now, lymphatics can be associated with this, and neurolymphatics is tied with the nervous system. This is your drainage. This is your sewer system. And if those are not working right, if they're not draining well, it can have an impact on both the muscle and the organ relationship to it. And so when you see the ones on the outside part here, those are major ones for drainage of the large intestine. The ones up here are the ones that drainage for the quads. So it's interesting to look at the different inputs in the body that can actually turn other things on and off. You can't ignore that. So these secondary things can be very, very important and have a tendency not to be even looked at. Acupuncture and acupuncture meridians are extremely important. And more than anything, it represents a certain system of the body. It flows from one point to another point, so they're called meridians, these electrical flow points. But another thing to look at meridians is does the meridian run through the area that you have the problem with? Take a look at this one. This is a liver meridian, and look where it goes in relationship to the knee and the leg. The gallbladder, which is another one that actually goes down to the foot all the way through, and look how far it goes, all the way up to the head and all the way down. You got to look at the gallbladder. If you have pains if I got pains in my side of my leg, if I have a problem in my knee, there's a major point that could be associated with a liver point, and these are totally missed. I'm going to give you an example. We had a person that came in, and I think the stomach meridian is not on this particular one, but it goes to the second toe. And this person went to a podiatrist, the regular family doctor. They went to a sports specialist, an orthopedic. They did various types of x-rays and films on the and MRIs on the foot, 6 months of the pain, and nobody could figure it out. What's interesting is the meridian for the stomach goes right through the second toe. It goes from underneath the eye, goes down and through the second toe. 2 treatments, pain was done. So the thing is open your eyes to other possibilities. I hate that term, it's stuck in a box or whatever, or the terminology. You want to be able to come out of that box, get out of the box and look at other things. It's amazing how the body works. And acupuncture is one of these things to take a look. Especially if it runs through an area, then you got to make sure the electrical flow is going the way it's supposed to. In acupuncture also, we also have a connection between the emotion of the body and an organ system of the body. And I want you to think about when we have energy that's stored in the body. If I were to jump physically from a shelf and land with my legs stiff, that energy gets caught in my leg and I can break a knee, sprain an ankle, so on and so forth. You got to disperse the energy. You're better when you jump off from that lip to roll and disperse and disperse the energy. Disperse the energy that's put into the body. Emotions can be kind of like the same way. You hold emotion, you try to deal with it, and you shove it someplace, but each emotion seems to have a location where it needs to go to. If you take a look at lung, for example, and acupuncture is associated with, lung is usually associated with grief. Liver is associated with anger. I had a lot of people coming in one particular week, about a month after being in second month or third month and COVID, and coming with right arm shoulder problems. Well, that's liver, because livers are those muscles in that part of the body, and they had a lot of anger. And so once we did the emotional point, it seemed to work a little bit better. Small intestine is going to be lost and vulnerable. Hamstring is going to be stubbornness. So those type of things are important in regards to looking at the overall health. This is where emotions can play a part. Another thing with meridians, they also seem to fall at the same muscle patterns in the body. So again, strengthening those out, like for example, the kidney meridian that runs right up through here is very similar to a myofascial meridian that runs through here for supporting the inside part of the leg. So wouldn't that be important to take a look at that to see if there's a possibility? Does the river run through it? Does it have support of that system? Is there an emotional relationship? Do the muscles of that meridian also associate with a certain organ system? Put the whole piece together. An important part in therapy too is when you find something that's stuck, you want to get it mobile, and you get something weak, you want to kind of strengthen it. One of the things that you can use is Kinesio Taping, and it's applied over muscles to reduce pain and inflammation, relax overused tired muscles, because it actually kind of helps support the muscle by actually moving with the muscle. And also it's a lymphatic drainage. It kind of helps drain some of the inflammation that might be around there. It is a non-restrictive type of taping which allows for full range of motion of the body. It's not to support the joint, it's more to support the muscle. So we went through anatomy, went through chemistry, and now we have to talk about stress. Stress has a profound physiological effect on the body that may interfere with the body's ability to recover and repair itself. Research indicates it impairs recovery. Even after adjusting for fitness, workload, and training experience, both perceived stress and life event stress impaired muscular force and perceived energy. In addition, we're also associated with more fatigue and soreness. Recovery was improved and faster in participants with lower stress. So to fight anti-stress, you have a couple different things. Cognitive behavioral exercises, Tai Chi and yoga. Why those are good is because they focus on a meditation of focus, a breathing, and movement patterns. Deep breathing, getting the diaphragm dropping far enough in the body, almost diaphragmatic breathing, in through the nose, expand the belly. The belly should come out first, and then followed by the chest. Meditation, humor, time management. A couple other additional things here would probably be journaling. Being able to journal things, get things off your head and put it down on a piece of paper. So you worry about it, you put it down, you can change it. You probably put it in an ABC format. So A would be the best outcome, B would be the most likely outcome, C would be the worst outcome. But you've already put it down. You've taken the fear out of the unknown by actually doing things and putting it out there. There is also some additional things called heart math, which is actually one to kind of do a biofeedback. And we'll eventually probably get into something called brain tapping in the office, but we still haven't started that yet. But it also has to do with parasympathetic and sympathetic training of the brain. Injury recall technique, a gentle procedure that used following during a recent or ancient injury or trauma. IRT restores muscle balance to pre-injury status, often dramatically relieving pain and restoring range of motion. To give an example, if you were to put your hand on a burner and burn your hand, the next time you come up there, you'd be thinking, I don't want to touch that. The body has built-in pieces or built-in protection mechanisms that tell it to pull your hand away. And these protective mechanisms, if you have enough of them, can start shortening up or tightening up your body in weird ways. And sometimes relieving some of these can have a major effect on your mobility. So the problem is we have an opioid addiction in this country, and they can be used correctly and they can be used incorrectly. All the opioids can cause side effects. Common adverse reactions to patients taking opioids for pain include nausea and vomiting, drowsiness, itching, dry mouth, dizziness, and constipation, and possible addiction. Sometimes drugs need drugs. And are you going to build your cabinet that way? Is your health really at the end of your life how many medications you have in your medicine cabinet? Nsaids, which stands for non-steroidal anti-inflammatory drugs. Side effects, as we talked about, nausea, vomiting, diarrhea, decreased appetite, dizziness, headache, drowsiness. The risk factors: increased risk of heart attack, 25% risk of increased hearing loss, 40 to 60% cardiovascular problems, 7,000 hospital stays, especially the GI area, 80% increase in miscarriage, 10 to 30% increase in allergic reactions. Nsaids deplete glutathione, a very powerful intracellular antioxidant, which has been depleted, is believed to cause liver damage. Kidneys can be damaged from taking both Nsaids and acetaminophen together. If you're looking at a surgical options for those dealing with painful knee issues range from arthroscopic knee surgery to total knee replacement. Recent research has shown some of the most popular arthroscopic surgeries have no benefit at all, including meniscus surgery. Knee replacement is extremely traumatic and carries a newfound risk of toxic wear particles entering your bloodstream. So this is where the heavy metals can sometimes leach out. Surgical risks aside, all surgeries minimally require months of painful rehab to regain strength and mobility, and most surgeries also accelerate the cascade of degeneration that leads to osteoarthritis. In 2008, a Canadian study compared the benefits of physical and medical therapy for arthroscopic surgery for osteoarthritis of the knee. Research concluded the physical and medical therapies provided equal benefits to surgery. In 2013, researchers compared the functional outcomes of the physical therapy versus the arthroscopic for patients with meniscal tears. They found that the arthroscopic followed by postoperative physical therapy had no benefit over the physical therapy alone. Problems with replacements, increased heart attack rates. That's because of the clotting situation. Bleeding ulcers, 6 times hip, 3 times knee. Metal ions in the blood. Size corresponds to the amount. High levels of cobalt, chromium, and titanium. Levels of activity lower than expected following knee or hip replacement. Severe persistent pain despite total knee or hip replacement. Allergies to metals.
Knee replacement prices soar as outcomes drop and complications mount. Perishing from hip replacements are 13 times higher for those patients age 80 and over. Heavier patients also do poorly after hip or knee replacement. Smoking. The one thing I think about, if you have to go for replacement, you're going to have to get some work done. And the better or more work you do after replacement, the better your outcome is going to be. But you've got to do the work and understand there's work to be done. There's new advances and medical advances. Stem cell and platelets-rich cell plasma procedures are the world's most advanced regenerative injection treatments for treating knee pain due to arthritis, meniscus tears, traumatic ligament injuries, overuse conditions, and other degenerative conditions. Again, the traditional options for patients suffering from these issues include arthroscopic knee surgery to repair ligaments, tears, or total knee replacement. With both surgeries, months of rehab are required to regain strength and mobility, and the patient must be aware of and prepared for associated risks. I apologize for this slide because it's a little bit older. The adult cells, stem cells, are from your own body that can renew themselves and turn into other cells and differentiate. And that's the key to differentiate. When you have tissue rejection, the cells of an organ is already preset. These cells are not preset. So when you get a donor from, let's say, umbilical cord, and also when you talk about umbilical cord, this is from umbilical cords. The only times they accept it is from a healthy birth with no complications. If it doesn't fall into that category, they don't take the stem cells from it. From that point, the stem cells are the highest amount and actually works best. If you were to take stem cells from somebody who's 80, the stem cell amount, the concentration is very low. Of course, the largest amount is going to be in the umbilical cord. Now, stem cell procedures help overcome this problem by extracting stem cells from an area of high volume, then concentrating these cells and rejecting them into naturally damaged areas that help the body heal naturally. Now, sometimes stem cell is used in coordination with PRP, which is blood platelet treatments. The platelet treatment plasma and the platelet lysate injection treatments contain healing growth components from your own body that increase your body's natural ability to repair itself. The use of PRP to repair your joint, tendon, ligament, and muscle injuries is becoming well known thanks to exposure from professional athletes. Platelet injection treatments are effective because they have a stimulating effect in the stem cells within the targeted area, making those stem cells work harder to heal damaged tissues. Now, going from back the other one, stem cells from umbilical cord combined with your own PRP is what we're talking about. Platelet procedures are commonly used for soft tissue injuries, mild arthritis, and spine conditions. There's also prolotherapy. It's a technique used to treat back injuries and chronic pain. It could also be knees and hips. It's involved injecting a dextrose solution into place for soft tissues injured, such as joint, muscle, tendon, or ligament. During prolotherapy treatment, the injection is usually paired with a local anesthetic, such as procaine or lidocaine. The solution can be sodium morate, sugar, or a mixture of sugar and phenol. A series of injections are given, usually 3 to 30, depending on the condition of the injured area, and it may take 3 to 6 months for a person to complete the injections. But prolotherapy might have some problems. Prolotherapy can cause a 30 to 40% acceleration in the recovery of acute ligament injuries, especially like the MCL and ATFL tears, estimates physiotherapist Adam Meekins. But several scientific studies said that did not find prolotherapy to have significant effects on the strength or laxity of the joints. Meekins comments that he does not believe in prolotherapy effects on other types of injuries, specifically injuries to the lower back, facet joint, and pubic symphysis. Prolotherapy can also have harmful effects, linking prolotherapy to allergic reactions to the treatment and nerve damage. But these findings were not severe, or not classified as serious. Long-term use of prolotherapy can actually cause a weakening of joints, Meekins speculates. And the reason being, you have different type of collagen types that make up the support and repair. And the type 3 collagen parts have been found to the ones in long-term prolotherapy users, where what types you want is a type 1, resulting in possibly a less stable joint. And this is in spine health. The problem with these therapies is probably most often, besides some of the other possible side effects, is the cost. Most health insurance policies do not currently cover prolotherapy nor stem cell or plasma. Payment is expected at the time of visit, and the cost will be $150 to $400 for the treatment. When you get to plasma to stem cells, it can be up to thousands of dollars, even as high as $100,000 investment. Now, with that said, I've been seeing more and more people doing this, and then competition is going to be dropping the numbers. but still is an expensive venture. That is a couple $1,000s per shot. And the question is, how many shots do you need to have? Now, in conclusion, we always have the old standby. When you talk about arthritis itself, and it's usually most of the hip and knee problems that we're dealing with, it's lack of range of motion, loss of joint space from what we talked about before. Heat is always going to be something that's going to be decent to use, and most often works really well. If you have a swollen joint, you might want to try use some ice. We've talked a great bit about what they do in Asia and Tai Chi and motion and movement, working the whole joint area. And again, we have all kinds of different exercises to work with. Leg squats, biceps curls, standing curls, knee extensions, overhead presses, bent forward flies, toe stands, things to keep things moving. When you got something locking up, you want to mobilize it. When something's too loose or weak, you got to strengthen it. Here's what we do in the office. We do a thorough history. Take into a lot of different things as account, as we talked about before. Check functional alignment from head to toe. Very, very important. Orthopedic and neurological testing, and those are testings based on some of the orthopedic tests. Gait scan, taking a look at how you walk and move. Take a walk down the hallway and see how the body moves. Applied kinesiology is working with, it's kind of like a functional neurology, testing the body through muscle testing, putting in standing position, sitting position, laying position. Sometimes a muscle will turn off. You got to ask the question why. Where is the weak muscle? Scar tissue evaluation. Scar tissue can shut down the muscle underneath it and make it weak. And so you have to do the treatment on that and learn how to treat it. And you also have to teach the patient how to do self-treatments on it. Advanced muscle testing the AMIT way. And that's doing the quadricep. Maybe you have to go into 14 different positions for the quad. You might have to go into 2 different positions or 4 different positions for the hamstrings, 2 different positions for just the gastrocs. There's a lot of different positions that you need to work on to make sure you're seeing where the problem is. Might do some imaging. By arthritis, a lot of times you maybe pick it up by looking at x-rays, for example. Blood work. Do we have any underlying causes, any inflammatory things that might be possibly poisoning the system? We do spit tests because those are usually for hormones. A lot of times you can find it in the spit. Circadian rhythms are associated with adrenal glands, and you have to take 4 spits of the day to really get a good idea about how the adrenal glands functions. EMI is a way to kind of technically take a broad brush of what the acupressure points are, and then what the heck are you eating? Our goals are going to be turn on the muscles, get them all strong, fix the alignments, treat IRT patterns, reduce mobilized scar tissues, control inflammation, control all 5 factors, and that's an applied kinesiology thing, looking at the lymphatics and vascular tone, looking at the acupuncture meridians and those kind of things. That's what that refers to. Appropriate exercises, kinesio taping for support, if you need to support that muscle, cold laser and other modalities. Now, cold laser actually working on the mitochondria to do self-repair and repairs anything from ligaments to muscles and things like that, and increasing the healing rate by as much as 30 to 40%. And then consider a co-treatment with a medical model. How far gone is this joint? And that concludes our program, but I want to leave you with something with a gift. You came here either for yourself or somebody else that might have a problem. And this offer could also expand out to immediate family if you need to, or if you have a very close friend you're really concerned about. In our office visit, it's a 2-office visit. The first visit, you gather information. You bring in some your x-rays or whatever, or blood work you have. Maybe we have to order some. The second visit, we report on it and find our reportings and correlating with some of the things we've talked about. So what I want to do is try to take some of the cost away from you, and we're going to make this a kind of like a tax-deductible donation, like a 501c3 charity. And instead of $225, it's $99 to caring for others. And who are caring for others? People who can't afford care. People who need maybe a grant or maybe a scholarship to go through school to learn some of these treatment protocols. It also goes to the food bank and battered women's shelters. So we use that money for donation purposes. We don't take it in ourselves personally. So if you want to take advantage of this for $99 instead of the $225, sign up give us a call, and we'll take care of you. God bless. Take care.
Thank you.